different forms of electromagnetic radiation and how it affects human health. I will talk about microwave radiation. Now, this is the electromagnetic spectrum, and here we have ionizing radiation that I don't think anyone would deny that it's harmful. I think everyone recognizes that if you're exposed to X-rays or ultraviolet radiation for a long period of time, then you're going to develop symptoms. Then we have a part of the spectrum that's called non-ionizing radiation. And within that, we have given different names to different parts of the spectrum. There's extremely low frequency down here. A lot of research has been done on that, and that's been associated with things like childhood leukemia for exposure in the home. There's a range called radio frequency that overlaps with microwaves. Then we have infrared and visible light. And the dirty electricity that I'm referring to is within this part of the electromagnetic spectrum. The World Health Organization refers to this as intermediate frequencies. The other part of the spectrum that's also very important and something that we're exposed to more and more is microwave radiation from a lot of the wireless technology that we're using. So that fits in this part of the spectrum. And together, all of these different types of exposures are referred to as electrosmog, which is a play on air pollution, which is another form of smog. We can be exposed to this through the air, through the ground, and through wires. And if we're talking about microwave radiation, one of the things we know about microwave radiation is that it can penetrate walls. That's one of the reasons we can use our cell phones inside the building, even though the antenna is outside the building. We also know that microwave radiation can be reflected by metal objects. So here we have a metal filing cabinet, and that can either increase or decrease your exposure depending on where you are compared to the filing cabinet compared to the source of radiation. And if you're in a room where there is a lot of metal objects and you turn on your microwave oven, for example, or you have other source of microwave radiation, then basically what you're doing is this is bouncing off all sorts of things in that environment. The bedroom, we know, is one of the most important rooms in your home because that's an important time when your body's actually regenerating. Having a metal bed frame or even metal springs in your bed will cause the metal to reflect the radiation, and so you can be exposed to higher levels just because of the metal around you. If you remove the metal, then you're exposed to much lower levels. Now, we know that microwave radiation is absorbed by water and fat. That's why we can put things in a microwave oven. Every single microwave oven except one that I've tested leaks microwaves. And so standing in front of an oven while your food is going around is probably one of the worst things that you can do. And there's a way of finding out if your microwave oven leaks. If you have a cell phone that you can use in your kitchen, if you can call it and it rings, so you have reception in your kitchen, and you take that phone and put it inside your microwave oven, okay, you close the door, but don't turn your microwave on. What you should do instead is you phone it. And if your phone rings inside your oven, it means the radiation was able to penetrate through, okay? So that's one of the ways that you can tell if your microwave oven leaks. Now, there are a number of different sources of high frequency, radio frequency, and microwave radiation. They come from cell towers, they come from your cell phone, Bluetooth, your cordless phone that's in your home, even wireless baby monitors and Wi-Fi. These are very, very important sources in your environment. And in North America, we now have something called a smart meter that they're putting on buildings to regulate the amount of, to measure the amount of electricity you're using. They're putting it on water, they're putting it on gas pipes. And this is causing radiation. Now, if you talk to the utility, they will tell you that this actually transmits for a very short period of time during the day. And so we went out and we started measuring what some of these are doing. And you're going to hear and see how the levels change. So you can see in this example that this meter on this person's home is almost constantly radiating. And if you look at the vegetation near the meter, do you notice anything different? Okay, right here, there seems to be damage to the vegetation. And this meter is actually directing the radiation in this direction. So if it can damage vegetation, you'd think it would probably have effects on human health as well. I'm just going to go to another example that I wanted to show you. We actually recorded different types of equipment that you might have in your home that generates microwave radiation. And I'm going to, if this works. Let me just get to the sound. Nope, for some reason. Let me just try it again. Nope. Okay, maybe I won't be able to show it to you. I'll try again because it worked a few minutes ago, so I'll try again. But basically what we did is we recorded different sounds from these different units, and if we could hear them, if we could actually hear what we're exposed to, or if we could see what we were exposed to, we probably wouldn't want to use the technology nearly as much as we're using it today. So cell towers are a serious problem, and there have been people, scientists around the world, looking at how it affects people who live at different distances from these cell towers. And what I'd like to do is share with you just some results that are done looking at mortality from cancer. This is a new study that just came out last year. It's in Brazil, and what they looked at was the cancer deaths for people who lived at different distances from base stations, which is basically a cell phone antenna. This is the distance away from the antenna, and this is the rate of mortality per 10,000. If the towers have absolutely no effect on mortality, you would expect this blue line. So that's the null hypothesis. And I think you can see here that the closer you live to one of these antennas, the higher your risk of dying from cancer is. So anything closer than 500 meters, and this is something that has been shown over and over again, a distance of 500 meters seems to be really critical for this. Now, the highest level of radiation that they measured in this particular example is at 4% of guidelines in my country and 4% of the international guidelines. So at very, very low levels that aren't regulated properly, we're finding that there's an increase in cancer. There have been two other studies looking at this. One is in Germany and one is in Israel, and they're finding virtually the same thing. If you live closer than about 350 to 400 meters to a cell tower, you have a greater risk of developing cancer. The other problem with living close to these cell towers is that you have symptoms of electro-hypersensitivity, which include fatigue, chronic fatigue, sleep disturbances, headaches, feelings of discomfort. All of these different symptoms tend to increase for people who live closer to these cell towers. Collectively, the symptoms are called electro-hypersensitivity, which is similar to multiple chemical sensitivity. I prefer to call it something else. I call it rapid aging syndrome, because the way that people explain away their symptoms is they say, well, I'm getting older. This is normal for me not to be able to sleep. Because when I was younger, I could sleep. Now I can't sleep. It's normal for me not to be able to remember things. And the difference between real aging and this type of sensitivity is that when you go into a clean electromagnetic environment, you sleep well, you're not in pain, you're not tired, you can think clearly. And that's really a very important difference. Now, there's also a lot of research done on mobile phones, particularly cancer. And last year, the World Health Organization came out and classified radio frequency radiation as a possible human carcinogen. And it's based on studies like this one. This was a cell phone study conducted by Dr. Leonard Hardell, who's a Swedish oncologist. And you can see here the people who used a cell phone for more than 10 years had an increase in ipsilateral tumors, which are tumors on the same side of the head that they hold the cell phone. For a brain tumor glioma, it was a 90% increase. For acoustic neuroma, which affects the nerve going to your ear, it was a 60% increase. And for an eye cancer, uveal melanoma, it was a 320% increase, all on the same side of your head after a 10-year latency period. They also looked at how old you were when you first started using a cell phone, and if you were under the age of 20, you had a 400% increased risk of developing a tumor after a 10-year period. And there's more and more young people, unfortunately, now using their cell phones. The conclusions from the study are the current standards for exposure to microwave radiation during mobile phone use is not safe for long-term exposure and needs to be revised. There are scientists and medical doctors around the world who are asking that the current guidelines we have for microwave radiation be reduced significantly, to less than 1% of the existing guidelines. So you can imagine how high they are. We also have evidence that radiation affects sperm. In a fertility clinic, they were looking at men to find out if there was a relationship between the quality of their sperm and the amount that they used a cell phone. And what they found is that things like sperm count, sperm motility, how quickly the sperm moved, how long the sperm lived, and the shape of the sperm varied by how much you used a cell phone. So for those who did not use a cell phone, this is what you would expect. And here, for those who used a cell phone for more than 4 hours a day, there was a decrease in all of these different parameters. And we know that reproduction, infertility, is becoming a very serious problem. Some of this is due to some of the xenoestrogens we have in the environment, but some of this is actually due to radiation as well. Some of the people who are electrically sensitive tell me that they can feel their heart palpitating when they're exposed. And some of them, it's so bad that they think they're actually having a heart attack. These are the symptoms: palpitations, arrhythmia, pain or pressure in the chest, and high or low blood pressure. So it really varies. And so what we decided to do is, because it's easy to measure the heart, it's obviously, you have different ways of monitoring the heart. We took the base of a cordless phone that radiates all the time. As soon as it's plugged in, it radiates, whether you're using it or not. And we asked the question, does it affect the heart? A very simple question. The frequency of this phone was 2.4 gigahertz, which is the same frequency that's used for your microwave oven. The intensity that we're allowed to use in North America, as well as the international guidelines, are 1,000. These are the units. And our cordless phone had 3. So we were at 0.3% of the guidelines for exposure. And we exposed people for a 3-minute period. We used a heart rate variability monitor. Both the person being tested as well as the doctor who was using the radiation, or who was documenting the radiation, were blinded. And this is the kind of results that we got. This is measuring the time between heartbeats. And so something that is higher here, it means a slower heart rate. Something that is lower, it means a faster heart rate. As I mentioned, both the scientist, the doctor, and the patient were blinded, so this was a double-blind experiment. And these are the results we got. This is a subject who was exposed for 3-minute periods. And this was their heart rate for each of those periods while they're lying down. And Dr. Marangel would look at this to try to figure out when they were exposed and whether the response was positive, negative, or neutral. For this example, this was the pre-exposure, this was the exposure, and this was the sham exposure. And this person was non-responsive. There was no difference. Here's another example. Okay, you can see quite a dramatic difference. This is when they were exposed to the phone. This is their sham exposure, and this is their heartbeat. So here we have a person who's lying down. Their heartbeat is 68 beats per minute, which is a resting rate, and then suddenly it jumps up to 122. It doubles instantly. So this person is actually really very, very sensitive. And you can see it's repeatable. This is an example of tachycardia, a rapid heart rate. We also measured how it affected the parasympathetic and sympathetic nervous system. So this is another subject. This is when they were exposed. You can see there's an increase in heartbeat. And this is how it affected their sympathetic nervous system and their parasympathetic nervous system each time they were exposed. And this is the equivalent of a stress response. This is a fight or flight response. Okay, I'm just going to show you one more example. This is a subject who became progressively worse. The more we exposed them, the worse they became, as you can see here. And so we didn't have a sympathetic response or a strong parasympathetic response until the third exposure. So everyone responds very, very differently to this form of radiation. This particular study is also peer-reviewed. It is the first study that documents immediate and dramatic changes in both heart rate and heart rate variability caused by an approved device that generates microwaves at levels that are well below the existing guidelines. One of the interesting things is that students now in schools are complaining of heart problems. They're complaining of palpitations, to the point where some of these students are actually taken to a cardiologist to find out if there is something wrong with their heart. This is a school in Ontario that had Wi-Fi introduced in the classroom. And this is how some of the people responded, some of the students responded to this radiation. A 6-year-old girl, musical heart. She gets headaches, she's dizzy, but only at school. A 12-year-old boy with tachycardia or a rapid heart rate. 12-year-old girl, nausea, vomiting, no fever. She has insomnia, blurred vision, tachycardia, only at school. A 13-year-old boy, heart pounding, insomnia, headaches. They moved to a different environment and all the symptoms disappeared. And here we have what happens to some of the kids who are in schools with Wi-Fi.
Hi, I'm Austin Lamont and I'm 14 years old. I go to Mountain View School. I've been suffering weird headaches and dizziness and displacement. Like, it feels like my head is, like there's a lot of pressure in my head and it's like repulsing like this. And I just feel like displaced, and then when I'm not there, nothing happens, so. And like, I get really like weak, and like it's hard to hold a pencil too, and I can't think straight.
Starting this year at Mountain View, I've been getting a lot of headaches, and it's been making me really dizzy, and like it feels like I can't concentrate, and you feel like you're not really there. It's hard to explain.
The thing that concerned us was that she always got better when she got home, and we couldn't figure out what was going on. We got her eyes checked and found out that wasn't it, and actually had everything checked and found out that wasn't it. And she's still, to this day, when she goes to class, probably about 4 out of the 5 days that she's there, she's coming home with a headache. And I mean significant headache where she has to take Tylenol or Advil.
The other type of study that we did was looking at the blood. And I didn't want to do too much on this, but I did want to show you one thing, is that I'm interested in the harmful effects of electromagnetic energy, but I'm also interested in how it can be used to heal. The research that was done in the former Soviet Union, much of the research they did was looking at therapies that could heal bones, that could get rid of depression, things of that nature, that would deal with pain. In North America, a lot of the research on microwaves and radio frequency radiation started at the other end of the spectrum. They were looking at how it affected military personnel who were exposed to radar. And so when they were setting up guidelines, the guideline was how low does it have to be before it causes serious damage to someone. Whereas in the Soviet Union, what they were looking at is these are the therapeutic effects. How high can we go before we cause damage? So we have totally different guidelines in those two countries. As a scientist, in order for me to understand the mechanisms involved, it's important to look at both sides of the spectrum. And all I would really like to do is show you two examples. Actually, I'll just show you one example. We went to places where they're doing research with this and where medical professions are actually using this as therapy to try to find out how successful they are and what it seems to work for. And one of the places we went was Liechtenstein, where they have something called a beamer technology. This is a mat that you lie on that gives you a certain frequency that's very similar to the natural frequency of the Earth. And then they document how you change. While we were there, we were introduced to the research of Dr. Rainier Klopp, who's with the Institute for Microcirculation in Berlin. And this is one of the largest institutes looking at microcirculation. The results that we saw were amazing. This is actually inside a body, looking at the flow of blood through the different vessels. And you can see here that some of the blood is very cloggy. It's not moving smoothly. This is what happens to the blood after a treatment that's about 10 minutes long. It's a very short treatment. It causes the blood to flow very easily through the blood vessel. I'm just going to show it to you again so you can watch them both at the same time. What this treatment does is it prevents the cells from sticking together, so it decreases the viscosity of the blood, and that can have all sorts of benefits for people who have heart problems, for people who have multiple sclerosis, because part of that is not enough circulation of the blood getting to the brain. The amazing part of this is what it does to white blood cells. Here we have white blood cells. This is after treatment and this is before treatment, and you can see the white blood cells are moving along the inside of the vessel here, whereas they were just speeding through. And this is a slow motion of one white blood cell that detects some contamination in your body, and it's actually squeezing through into your cells to go after the infection. Absolutely remarkable type of photography that's being done here. And one of the things they found is that exposure to this radiation, to this healing energy, is actually benefiting the body enormously. It's boosting your immune system, which will then have all sorts of benefits to your health. Basically, what we found is that there's a change in blood viscosity, there's a change in blood circulation, there's a change to your immune system. We know that this therapy has been used to heal bone fractures for a long time. It's been used for at least 50 years that I'm aware of. It's being tested currently for depression, for people who are depressed, but the pharmaceutical drugs don't seem to work. And it's used to it's used for treating chronic pain as well. More and more of the devices are ones, initially the devices were used only in a hospital setting, and now they're making small devices that you can take home and use in your home environment as well. These are some of the symptoms that they've been, or tests that they've been used for. And what's really important is these pulse electromagnetic field devices, they do not treat a condition. What they do is they promote your body's ability to heal itself. And I think the more research we can do on helping the body heal itself and to protect it against other types of exposure like the dirty electricity and the microwaves, I think that's really the medicine of the future. I think energy medicine is going to play a much larger role in the future than it has played so far. And I think with that, I'm just going to end the talk. So really, this talk is to a certain degree about looking at the harmful effects of electrosmog and the beneficial effects of some of the electrotherapies that are being used currently in labs around the world and in hospitals around the world. Thank you very much.